If you think about it, it's pretty unique that the University of Missouri has a medical school, a law school, and a veterinary school all on the same campus. In addition, they have a large academic medical center with a full array of graduate medical education programs.
The fact that we have the University Hospital embedded in the University of Missouri with the School of Medicine adjacent, we have a School of Nursing. It's so rich in terms of the kinds of learning that we're able to do from each other clinically and beyond our clinical activies.
So we have a full array of educational experiences to offer our trainees here. We have grand rounds, we have morning report, we have noon conferences. All of our divisions also have their own divisional grand rounds and subspecialty lectures that they give as well. I think the combination of the larger academic medical experience in a sort of smaller, tighter-knit community is really unique.
We have a pretty big residency program. We have a lot of subspecialty fellowship programs. So we're surrounded by people who are learning, who are generating new knowledge, and are here to take great care of patients.
We are a large academic medical center in a medium-sized town, and we have this great combination of, a great variety of clinical cases coupled with a great lifestyle. So we really are the medical center for the state of Missouri. We get referrals from all the corners of the state. And that really gives us a nice combination of sort of the routine cases that we get from our own community and the immediate surrounding area, as well as the more interesting cases that get referred in from elsewhere.
Our three organizing focus areas are clinical excellence, exemplary education, that's why people come here to learn, and exemplary research. The care of Missourians and discovery that lets us affect the care in a positive way for people beyond Missouri is why we exist as a land-grant School of Medicine. I think we're a really nice balance between a big enough program to have the diversity of people, of ideas, of experiences that we need for a really strong residency program and really strong fellowships, but small enough that you're not going to be a face in the crowd. People will know you, people will see your work, people will follow up with you.
The most important thing to me is that no fellow who graduates ever feels as though they are incapable of taking care of someone.
To me, wellness is more of providing a supportive environment for the people that work there, and so it's about trying to engage people, making sure that we're listening to their concerns, acting on those concerns when we can, understanding that each of our trainees is a unique person with unique circumstances that sometimes requires a unique response. Don't really believe in the cookie-cutter approach to personnel management, and more understanding that everybody comes to this with a unique set of experiences that has to be dealt with in an individual way.
Anyone that comes out of this program will be a very, very good clinician. I think that we have a close-knit staff. I consider it, I always say, the Alice. So the Alice is like a family. If you work here, your co-workers, and I don't just mean your staff, I mean the nursing, from the people that check you in, for the people that clean the rooms, everyone. I think everyone is kind of considered family. We're close-knit. Everyone knows the staff well. Everyone knows the fellows well. And everyone, I think, has major concern for the fellows' interest. We see everything because we are a referral center. So all the common diseases you see, plus we see esoteric diseases because we're a referral center. Right when they start, each fellow has 2 continuity clinics, and they carry those continuity clinics throughout their 3 years. So they're primarily responsible. They do have a staff. Obviously, when you're a first-year fellow, there's more leadership involved, but in your second and third year, and by your third year, you're more or less working autonomously. You run your kind of the clinic, but there's a staff there with you. That way you build up confidence from your first year to your second year to your third year. So the fellows that graduate from here, they know how to interpret blood smears well, know how to approach patients with malignant and benign hematology. We have conference 5 days a week for the fellows, 8 to 9. Every Monday, we go over peripheral bloods, bone marrows, and hematopathology, including lymph nodes. Tuesday, there's thoracic conference, where I give a lecture every other Tuesday. Wednesday, there's a regular tumor board. Thursday, didactic. Friday, sarcomas, etc. We have regular grand rounds, and we have oncology grand rounds. As far as all the subspecialties, even within our own area, we cover all of them, and then you can take electives, obviously, in hematopathology, blood banking, radiation oncology, gyn-onc, pediatric oncology, and we do send the fellows to away for the bone marrow transplant. There has been other fellows that wanted other maybe more extensive experience in clotting or benign hematology. So we would try a range if someone wanted something specifically. For a couple of years in a row, they went to the University of North Carolina, Chapel Hill, and someone went to the NCI for a month to do more in the development of clinical trials. If you're more interested in clinical research, clinical trials, and maybe some basic research, and you want to be an expert clinician, then I think you'll be able to get that here. I want fellows that are excited about what they do, that are independently motivated, they're scientifically inquisitive, they're very hard working, and they have a long-term goal, I would say, more on the academic side than going into private practice. And I would say that all the fellows that graduate from our program, they're well versed in hematology and oncology.
It's just a really wonderful size and balance between all of the energy and excitement and forward thought of an academic medical center with a place that's easy to live.
By having the university here, it brings in enormous amounts of diversity and other opportunities to explore things that you might find only in a bigger city.
I do love this town. It has a charm to it. I feel like people they smile, when you meet them. And I've been to many big cities and you don't have that, that friendliness.
There's a huge network of trails for walking, running, biking. There's local breweries and a vineyard. There's some distilleries around.
I can go canoeing, kayaking, bike riding, right from my house.
We have 4 kids and our public education system is top-notch.
Much of Columbia is focused on education and healthcare. Because of that, we draw more culture to Columbia and have more of a cosmopolitan feel than other towns our size.
You're going to have most of the big city amenities, theater, ball, we have Division I athletics, of course, the Missouri Tigers, members of the SEC conference.
We're looking for people who are curious, who are flexible, who don't expect everything to be the way it is today and want to be part of that change. People who demonstrate curiosity, flexibility, and also just a deep and unfailing commitment to their patients.